Hello and welcome to the Zero to Finals podcast. My name is Tom, and in this episode, I'm going to be talking to you about cleft lip and cleft palate. And if you want to follow along with written notes on this topic, you can follow along at zerotofinals.com/cleftlip or in the ENT section of the Zero to Finals Pediatrics book. So let's get straight into it. A cleft lip is a congenital condition where there's a split or open section of the upper lip. This opening can occur at any point along the top lip and can extend as high as the nose. A cleft palate is where a defect exists in the hard or the soft palate at the roof of the mouth. This leaves an opening between the mouth and the nasal cavity. Cleft lip and cleft palate can occur together or on their own. Most cases of cleft lip or cleft palate occur randomly. Having a relative with a cleft lip or palate makes it slightly more likely, however it does not follow a traditional inheritance pattern. 3 in 10 cases of cleft lip or cleft palate are associated with another underlying syndrome. Let's talk about the complications of having a cleft lip or a cleft palate. Neither are life-threatening conditions, although it can lead to significant problems with feeding, swallowing, and speech. It can also have significant psychosocial implications, such as affecting bonding between the mother and the child. Surgery generally resolves these problems. Children with cleft palates can be more prone to hearing problems, ear infections, and glue ear. Let's talk about management. Patients should be referred to the local cleft lip service. This involves a specialist multidisciplinary team that includes specialist nurses to support and coordinate care, plastic, maxillofacial and ENT surgeons, dentists, speech and language therapists, psychologists, and general practitioners. The first priority is to ensure the baby can eat and drink. This may involve specially shaped bottles and teats. The specialist nurse will follow the child through surgery and beyond to ensure good development. Definitive management is with surgical correction. This leaves a subtle scar but is generally very successful and gives full functionality to the child. Cleft lip surgery is usually performed at 3 months, whereas cleft palate surgery is done at 6 to 12 months. So thanks for listening to this episode on cleft lip and cleft palate. A big thank you as always to Harry Watchman for perfectly editing the podcast. You can find plenty more resources on the Zero to Finals website at zerotofinals.com, and I hope you tune in for the next episode where we're going to talk about tongue tie.